My name is Jamie Smith, and this is my head-to-toe assessment video for Nursing 612 with Maryville University. This is my patient Jade. She's going to be helping us out today with the assessment video. Before we came in the room, we had her empty her bladder. We had her vital signs done, her height and weight. We had her change into a tank top and shorts instead of a gown. We also tested her vision with the Snellen chart for distance and the Rosenbaum chart for near vision. We're going to start out by just looking at her face here. Her face is symmetrical. Her skin is nice and warm and it's pink. There is no bruising, no trauma, no scratchings, no drainage anywhere on her face. Her ears are symmetrical to her face and her eyes are also symmetrical on her face. Moving on to her skull, we're going to palpate her scalp. It is freely movable. I don't feel any masses, lumps, or is there any tenderness when I do your scalp there?
No.
Okay, her skull is normal cephalic and she's able to hold her head up in an erect position, which is a normal finding. She shouldn't be drooping at all. Her hair is brown. It is intact and is very thick. It looks like her hair follicles are intact. There is no alopecia noted to her hair at all. Next we are going to move on to cranial nerve number 7. We're going to have you wrinkle your forehead, squeeze your eyes shut, clench your teeth, smile, stick out your tongue, and puff your cheeks out for us. And that is cranial nerve number 7, and all of those are intact. Next, we're going to test her light sensation with the sharp end and the soft end of a Q-tip here. Can you close your eyes for me and tell me if it's soft or hard?
Soft. Hard. Soft. Hard. Soft. Hard.
Okay, and that is trigeminal cranial nerve, and that's cranial nerve number 5 for the light sensation. Next, we are going to move on to her sinuses. We're going to do her frontal sinuses, maxillary. Is there any pain or tenderness?
No.
Okay. And her facial bones. Make sure that they are all intact here. Any pain or tenderness with palpation of your facial bones?
No.
Okay. Next, we're going to do your TMJ, the temporomandibular joint. Can you open and close your mouth? Any pops or clicks?
No.
Any tenderness?
No.
Okay. There should be no pops or clicks of the jaw when testing that. Next, we're going to move on to your eyes. Her eyebrows are nice and even. The hair is soft. It extends to the outer canthus of the eye. We're going to look at the conjunctiva of the eye. It's nice and pink and moist. The sclera of her eye is nice and white. If it was to be yellowed, it could mean she has jaundice for some reason. Her eyelashes extend outward. There's none of them poking her in the eye at all. Can you close your eyes for me? I'm going to palpate here. Any pain or tenderness?
No.
I'm checking her lacrimal apparatus. There's no drainage in the corners of her eyes, no crusting noted or anything like that. Next, we're going to test her pupil response with our pen light here. Can you just look straight for me? Look at the camera. We're going to come from the side here. And the pupils are constricting nicely. They're direct and concentrical. They're equal and round and reactive to light. Next, we're going to do what we call the uncover and cover test. We're going to have you cover one eye for me and look straight ahead at the object on the wall. And uncover for me, and cover the other one, and uncover for me. Okay, there is no strabismus, no nystagmus noted with the cover and uncover test. Her eyes stay even and straight when she uncovers them, which is normal. Next, we are going to do your 6 cardinal fields of gaze, which is cranial nerves 3, 4, and 6. I'm going to stand in front of her and have her follow my pen light as I move it. And keep your head nice and straight for me. And have her follow this. appears all her cranial nerves with the 6 cardinal fields of gaze are intact. I think we are done with the eyes now. We are going to move on to the ears. First, we're going to see that her ears are placed evenly on her head. The top of her auricle is even with the outer canthus of her eye, which means her ears are not low set. We're going to palpate your auricles. Is there any pain or tenderness on palpation? Okay. The auricles of her ear are nice and pink. There's no scabbing or anything on them. We are going to look in her ears at her tympanic membranes. Her ear canal appears nice and pink, no drainage, no lesions or anything. To look in the tympanic membrane, we're going to pull her auricle up and back to get a good view. Her tympanic membrane is nice and gray and pearly, which is what we want. There is no bulging noted. There's no drainage. There's no erythema in the ear or tympanic membrane. We're going to move on to cranial nerve number 8, which is hearing. We are going to do the whisper test first. So I'm going to get behind her. I'm going to have her cover one ear, and I'm going to whisper a series of letters or numbers and have her repeat them back.
A, B, C.
Okay, cover your other ear for me.
B, D, E.
Okay. The whisper test is positive if they get over 50% right, and she got 100, which means her hearing is intact with the whisper test. Next, we're going to use the tuning fork and do the Weber test. We're going to strike the fork, place it on top of her head here, and see if she can hear equally in both ears. Can you hear equally in both ears?
Yes.
Okay, and that's a normal finding. And next, we're going to move on to the Renee test. We're going to strike this, place it on the mastoid bone back here, and place it in front of the ear then and test air conduction versus bone conduction. Just tell me when this stops.
Okay.
And when it stops.
No.
Okay. And the air conduction should be 2 times longer than the bone conduction. That's for cranial nerve number 8 with hearing. I think we are done with the ears. Now we're going to move on to her nose. Her nose appears to be normal. It's nice and pink and warm. The septum appears to be midline and not deviated at all. We are going to take a peek inside her nose here. And can you look back for me? Her membranes are nice and pink and moist. There's no bogginess, blueness, or paleness noted, which would mean she has allergies. And we're going to test the patency of her nostrils. Can you cover one nostril for me? And can you breathe normal? Okay. Can you cover the other nostril for me? Can you breathe normal out of that one? Okay. She has good patency of both nares and can breathe normally when one is covered. And that's a normal finding. Next, we're going to move on to her mouth and oral pharynx. We're going to do some inspection here. Her lips are nice and pink. They are moist. There's no fissures in the corner, no cracks or drainage from the lips at all. We are going to look inside her mouth, just inspect here. Your anterior pillars are intact. Your uvula is there. She's missing her tonsils. She's had a tonsillectomy. Let's see, the hard palate and soft palate of her mouth are intact. And can you touch your tongue to the top of your mouth? It's nice and pink and moist under there. There's no signs of oral cancer, which would be found under the tongue. Next, I'm going to look at your teeth. Teeth are nice and white. There is a chipped tooth on her left-hand side here, which is normal. I do not see any fillings or any loose teeth at all. Let's look at your uvula. Can you say ah for me?
Ah.
Okay, the uvula rises when we look in the back of her throat. And next we're going to test her gag reflex, which is cranial nerve number 10. Okay, her gag reflex is intact. And next we are going to move on to her neck. Okay, just looking at her neck, it's symmetrical. Her trapezius muscles are nice and intact here on this side. We're going to feel for her carotid pulses. one at a time. They are equal and they are strong. The trachea is midline here. And can you swallow for me? Okay. The thyroid is present and it moves up when she swallows, which is a normal finding. Can you move your head from side to side, shrug your shoulder up? Okay. The shrugging of the shoulders is cranial nerve number 11 and it is intact. Can you move your head back and tilt it forward for me? Okay. Now we're going to do that with a little resistance. Okay. She meets my resistance well. And forward. And forward. Okay. And back for me. Okay. She has good resistance when meeting my hand there. Next, with the neck, we're going to move on to the lymph nodes, which there are several of here. We're going to do the occipital, the preauricular, postauricular, tonsillar, submandibular, submental, superficial cervical chain, posterior cervical chain, and the deep cervical, and the supraclavicular along the supraclavicular line here. If you lift up your armpits for me, we're going to do the axillary lymph nodes here, and the infraclavicular is also under the arm. There is no lymphadenopathy, no swelling, any tenderness with any palpation of lymph nodes?
No.
Okay. Next, we're going to move on to her arms. We're going to have her hold her arms out straight for us. There is good muscle mass on both sides. Her arms are nice and symmetrical when she holds them out. Her skin is pink and warm. There is no trauma, any lesions. There are a few freckles and moles noted on her arms, none that stand out to me in particular. And we're going to test your reflex here, your brachioradial reflex, right along her arm here. Just get a good reflex. It's kind of hard to find sometimes. And next we're going to do her radial pulses on both sides. They should be nice and equal and normal rate and rhythm, and they are. Brachial up here is nice and normal and equal as well, which is a normal finding. One thing I forgot to do with the neck was listen with the bell of my stethoscope to make sure there's no bruise or thrills, so I'm going to do that now. I'm going to have her take a deep breath and hold it as I listen. Deep breath for me and hold it. Okay. There are no bruises heard in the neck, which is a normal finding. If you heard one, you would want to get it further examined. Next, we're going to move on to her back. I'm going to have her turn a little bit more towards the camera here. I'm going to assess her spine. Make sure all her vertebrae feel intact. Make sure there's no scoliosis. The spine appears to be intact. We're going to check the costovertebral angles down here, which are kind of over the kidneys, to make sure there's no pain or tenderness, okay? Any pain or tenderness?
No.
Okay. The skin on her back does appear nice and pink. There are a few nevi noted here. It's nice and warm. There is no hair noted. Okay, next we are going to do some percussion on her back here. We want there to be no resonance. We're going to percuss going from side to side. You may find some dullness if there's an organ. That's mostly on the anterior chest. Okay, and we're going to percuss laterally. And there's also no resonance noted there. Okay, we're going to check for tactile fremitus. We're going to place our hands on Jade's back here, and we're going to have her say 99.
99. 99. 99. 99.
Okay, there is no tactile fremitus noted, and as we're doing that, we can tell her respirations are even and our regular rate. There's good expansion of her lungs here. We're going to check for diaphragmatic excursion. Down the right side here, we're going to move down until we hit dullness. which is right there. And we're going to move up until we hit dullness again, which is right there. That measurement right there should be 3 to 5 centimeters. If it's over that, that could mean there is some sort of tumor or infection that we need to be looking for. Next, I'm going to listen to her posterior lung sounds. I'm going to move from side to side and have her just take nice deep breaths as I do so. I think we are done with your back now. I'm going to have you turn around to the front. We are going to look at the skin on her chest, which is nice and pink. It's warm to the touch. There is a scar down here lower on her chest, which is normal for her. We're going to check for the precordium, make sure there's no thrills or bruits. The chest wall is intact. Your apical impulse is kind of harder on a woman to feel. You can feel it. It is normal. We are going to listen to her heart sounds and then her lung sounds. We're going to listen to the 5 heart sounds first. Listen to the apical, pulmonic, Erb's point, tricuspid, and the mitral. And those are all normal rate and rhythm, and they're regular. We're going to listen to her lung sounds now, moving from side to side. Respirations are nice and even. Chest expansion is normal. Her breath sounds are equal on both sides. There are no crackles, no wheezes. Back to the heart, she did have a normal S1 and S2 heart sounds with no thrills, rubs, murmurs, or anything wrong with the heart. We are going to now have her lay back. We're going to look at her abdomen. First, we are going to just pull up her shirt a little bit. We're going to inspect her abdomen. There's no thrills, no bruits, no pulsations. There is a good contour of her abdomen. There appears to be no masses, lesions. Her skin is nice and pink. It's warm to the touch. Next, we are going to move on to, we're going to listen first before we palpate. Listen to all 4 quadrants. Our bowel sounds should be present. In all 4, we would listen for at least 5 minutes before we say she has no bowel sounds. Next, we're going to percuss, or actually we're going to palpate first. We're going to do some light palpation. Is there any pain or tenderness?
No.
Okay. Did the deeper palpation, it's just a little bit more force. I don't feel any masses, any lumps, any bumps, any tenderness.
No.
Okay. Next, we're going to percuss and palpate the liver, which is on the right side here. We're going to go down on the right side until we find the liver, which would be a dull sound. Okay, the liver started about right up here. There is no resonance noted when percussing. The liver span is about 10 centimeters, which is normal. To palpate the liver, you kind of do some deep palpation. Can you take a big, deep breath for me? And you kind of can go up under the rib and feel that her liver is there and it's a normal size, which is about 10 centimeters. Next, we're going to move over to the patient's left-hand side. We are going to percuss for the spleen. There is no resonance heard. There is a dull sound above the spleen up here. And when we palpate, we really shouldn't be able to feel the spleen at all. And while we're here, we're going to palpate the kidneys. And here. Kidneys appear normal. Is there any pain or tenderness with palpation of the kidneys?
No.
Okay, we're going to listen with the bell of our stethoscope now to her abdomen for the aortic. And the renal. The iliac. And finally down here, the femoral. We're going to go over her shorts. Okay, those all feel normal. I think we are done with the abdomen now. I'm going to have her sit up. And we're going to move on to the reflexes. We're going to look at her feet and legs first. We're going to have her scoot back just a little bit. Her legs are nice and symmetrical. Muscle mass is normal. There is no hair noted, but she does shave her legs. They're nice and pink and no drainage noted, and they're warm to the touch. We're going to feel her dorsalis pedis pulse on top of her foot here. Make sure you can see that I'm on top of her foot. Tibial pulses are on the sides here. They're nice and strong and equal. And behind her knee is the popliteal pulse. Those are also nice and strong and equal. We're going to check the Achilles reflex here. We have a good reflex. And I'm going to have you scoot forward here. And we're going to check your knee reflexes here. And those are also nice and normal. We're going to have her now stand up in front of the camera here. We're going to have her turn. We're going to check out her spine again. And we're going to have her touch her toes. There's no curvature noted to her spine. It's nice and straight. Good muscles on the side here. Can you twist from side to side? And can you tip yourself side to side here? She has good musculoskeletal system. At this time, I think you can go ahead and sit back down. I think we are done with our head to toe assessment. Thank you for watching.